And I did go to inpatient rehab. It was very expensive, and there was zero talk about biochemical restoration or obviously NAD. Actually, the only talk there was we were encouraged by a counselor at one point to laugh at the idiots out there who thought that you could, quote, cure alcoholism with vitamins. And along with everyone else, I was like, ha ha ha, isn't that funny? Because we'd been brainwashed to think that the only way was 12-step. And again, I have to tread carefully, because there are a lot of people who reach out to me for whom biochemical restoration is a missing link in their program, which they need to fix. But we don't want to throw the baby out with the bathwater for people who do benefit from that. I think psycho-spiritual work can be profoundly important, but it does sometimes make my blood boil when people could be helped just with these missing links being filled in. And so that's, what I've tried to do. And I'm not a doctor, as my audience knows. I used to work in finance. I had no I would ever be reading dozens of or hundreds of books and studies on this topic. I did it for myself, and then I try to motivate people to educate themselves as well. But I'm very relieved when I see people who, go become board certified in addiction medicine, something I'll never do, and hopefully slowly start to change that paradigm. So I'd imagine that we might have some doctors in this audience. I'm actually always pleasantly surprised by how many doctors have signed up for my online course just to get some extra support. And I know it takes some putting ego aside for some people. They should know more about this stuff than I do, but it's a missing link in education for a lot of doctors. And then they email me and tell me how well they're doing later. But I think there's always an initial skepticism. So if there are doctors in our audience who are watching this, how might you, in a nutshell, if possible, explain the nature of the missing link of the biochemical repair, some of the strategies you use, maybe including NAD, but also I know you do Myers cocktails, B12 shots, you try to address ATP deficiency. There's a range of things, customize the program for people, but how does that all fit in? I know you started out with medication-assisted treatment. What was it like to kind of obviously not leave that behind entirely, but start to embrace these new concepts?
Well, the nutritional aspects of recovery, which you're so well versed in, and I enjoy and I practice it and I believe in it, I think is an important part. But I think we need to back the lens up, because what's even more important is creating that environment and stewardship of accountability, about honesty, about integrity, and getting people connected into a recovery community, right? I think those are the big things, because I always tell patients, look at medication. Once people are safely detoxed, let me back up, right? Once people are safely detoxed off alcohol, and then we have a follow-up visit and they've been sober for, say, a week or so, I usually say, look at medicines have a small role. There's prescriptions that we can use like naltrexone or gabapentin or Antabuse, and here's how they work. Not everybody needs this. This is just a small role, and this is a good tool. If you want to try something like that, go ahead. But here's some other things that can help you decrease cravings and help you feel better and improve your energy and improve your memory and improve your mind and just help. And then I kind of go on to my list of, here's some basic nutrition, here's some supplements, here's some more aggressive things that you can do. So the first thing is just get into a program of community and support and connection, right? But speaking about nutrition, look, alcohol causes a nutritional wasteland, right? You burn through all your NAD. Anybody can just Google right now images alcohol metabolism, and you'll see that you use 2 molecules of NAD to metabolize 1 molecule of alcohol. Well, so if you're a drinker, you're NAD deficient. And doctors a long time ago in the 50s figured this out, right? And started supplementing people with NAD. And when you give those patients NAD, they, withdrawal goes away. They just feel so much better. Like their skin glows. It's just unimaginable what you see. Cravings go down. Their life comes back. Their energy systems improve, because NAD, as we know now, is involved in over 400 important reactions, from sleep to immune system health to aging to telomere destruction. So many things are NAD dependent. It's certainly all, and the big thing now is longevity, right? You can't, if anything you Google about NAD now is all longevity and Sinclair and, anti-aging. So, but yeah, so we have found, like I take no credit for inventing any of this stuff, right? But we have found and believe that when we give these patients intense nutritional replenishment, IV, NAD, but Myers cocktails, B vitamins, B complex, B12, thiamine, vitamin C, magnesium, the resiliency is just, they just feel so much better, so faster, their recovery goes smoother. And of course, I'm not saying you do that in place of a recovery program, but when those patients who do these intense nutritional programs absolutely feel better faster, recover faster, and struggle less.